Further debate, recognize the member for Ottawa South.
Thank you very much, Speaker. And I'm pleased to stand to rise today and support Bill 192 from the member from Nickel Belt and congratulate her again on bringing forward a sensible, thoughtful bill. This essentially are international standards. These are things that are accepted across the world. I come at this from, I'm the son of a hospital nurse. She worked at National Defence Medical Centre for 33 years on the floors. I used to pick her up at work when my dad was away. So here's the thing I know. If my mom finished shift at 11 o'clock, I didn't need to get there at 11 o'clock. I should probably get there around 20 after. And then maybe by 11:45, she'd be coming out. And that's because she stayed to make sure that her job was fully done. And she had good ratios back then. This isn't going to work, okay? And I want it to work. But it's not going to work if you don't have the nurses to fill it, to fuel it, to make it work. And when I hear arguments from the government like, you voted against this or you voted against that budget, it's like I can list off a bunch of things. Nursing graduate guarantee, your party voted against. Late-stage nursing program to keep nurses in the profession, you voted against that. It's not about that. We don't have enough nurses. And things like Bill 124, right, that essentially take away nurses' rights to bargain. Right? Nurses' rights to bargain. And the thing I remember about that is there was a whole bunch of other people who could still bargain. They were mostly men. Nurses are not exclusively women, but they're mostly women, but you took away their bargaining rights. It's a total lack of respect. If you want to keep people working for you, you need to respect them. And the Premier's wrong-headedness and the Minister of Health's wrong-headedness of continuing with Bill 124 did more damage than anything else. The second thing is, you got to pay them. Right? That's the other thing about Bill 124. But right now, you've got to pay them. And why are nurses leaving to go to work for private agencies? The pressure they're feeling at work, not enough staff to help them. They feel like they can't do what they are taught to do, what they desire to do for their patients. They don't have enough time. Why did my mom stay for 45 minutes? Because she wanted to finish the job. They want to finish the job. They have to have enough people. That's the point. So the government needs to look at how they can do more, not just to train more nurses, but to retain more nurses. Because that's a problem. And unless we do that, unless we retain what we have and train up as much as we can, we're not going to get to where we're going to be able to do this. So I would hope that the government would vote for this today and support it. Even though we know we can't do it today, because what it does is it sets a standard that we have to achieve and that we all want to achieve. And we're talking a lot about nurses. That's what this is about. It's about patients. It's about patients. It's about the care that patients need and deserve so they can get well. That's why the member's putting this forward. And I'm going to say one last thing about priorities. How is it that spending $1 billion to get beer and wine at the corner store a little more than a year earlier is more important than nurses and their patients, is more important than 2.3 million Ontarians who don't have access to family medicine? How is it more important than people having to use their credit card instead of their OHIP card so they can get basic services? And those things are the things that are happening here in Ontario right now. And to spend $1 billion to make booze a priority over health care is just simply wrong. Thank you, Speaker.